Should we use ice for acute lower back pain? This is a question I'm commonly asked when I have somebody with a recent flare-up of their lower back. And the reality is it's probably not as effective for managing inflammation as what we commonly think. And there's a few reasons for that, but one thing I just wanted to point out is just a bit of the anatomy of the lower back. Commonly, people will present with a disc irritation, maybe pain to the disc area, and we think that there's some inflammation associated with it. And the common advice is to put ice on the lower back to help manage the inflammation. But the reality is, where that little bit of inflammation is probably too deep for that temperature reduction from the ice pack to actually affect. If you can see through here, the disc itself, this is the back of the spine, where we most commonly get little strains to the disc is over here. Now, in between here and our skin is about that much. So we have skin, we've got a level of fat, we've got a layer of muscle, then we've got some bone, then we've got some ligaments, then we've got the nerve and the spinal cord, and then the disc. So if that ice were to affect the area of inflammation, it has to go through our nerves and our spinal cord itself, which in itself would be very painful. The chances of that temperature change going that deep is absolutely minimal, considering our skin is an excellent insulator. So why would we use ice? We might use ice just to give us a numbing effect. We might use it just to help manage the pain, but it most likely is not going to actually affect the inflammation at the spine or at the injury. What has been shown to be very effective is movement. Moving in non-provocative ways, moving in ways that feel good or at least don't exacerbate the symptoms, seems to be one of the best things we can do to manage pain in acute flare-ups.